In this video, you will be learning about depression and suicide prevention. We will address questions like, to what degree it is our responsibility to help depressed and suicidal person, and to what degree it is their responsibility to help themselves. Can a depressed person help another depressed person? How do you fall into depression, and what to do to avoid falling into depression? Is it only a medical professional who can identify if someone is depressed and needs extra help? And how can anyone learn to identify this state? What are the red flags of suicidal possibility? Why would a person tell that they want to die? Do they usually want to be helped? This video is part 2 of the 4-part series Suicide Prevention on my channel. An important disclaimer is that suicide can and should be prevented by health professionals. Please visit hospital if you have suicidal intentions or call a hotline in your area. You can find crisis numbers for Finland on the screen and more information in the description for this video. The purpose of this video series is to spread awareness about mental health. To what degree it is our responsibility to help, and to what degree it's their responsibility to help themselves?
Yeah. I mean, I think in many ways, like a person with high suicidality or really severe depression is quite unwell in many senses and is not able to look after themselves properly. They need people around them who are thinking more clearly, who aren't depressed, who can plan, who can assist them. So in the sense that a person with depression is unwell, I do think people around them should help. But of course there can be situations where a person might be quite suicidal but not really depressed, and like in the existential crisis or a cry for help. And in that situation, other people might not be able to help as much.
Can a depressed person help another depressed person?
That's a good question. I think so, but I think it's really difficult. But to be honest, many partners and spouses of a depressed person do eventually become depressed themselves because of the difficulty of being with that depressed person, especially if they've been really suicidal for many months or many years. And so often the spouse of the depressed person, when the depressed person starts to get a bit better, they finally feel like, okay, now I can relax, and when I relax I realize how exhausted I am, and then they also fall into a depression, and it might be quite serious, and they also need to get treatment for themselves.
So how do you fall into depression? I remember you were saying last time we talked that there was a cycle or something.
That's right, yeah. So the cycle of depression, is that you might feel, a bit sad, a bit tired, a bit fatigued, some of the kind of minor symptoms of depression. And then you might think, oh, well, I can't be bothered to go to my friend's party this weekend because I feel a bit tired. I'm not in a really good mood. I won't go. So then you avoid activities. So that would be avoiding going to a party. You might also think, I'm meant to be writing my assignment, but I'm also tired, so I won't write my assignment. And then the next week comes around, and because you've neglected to do your assignment, and because you haven't gone to the party and you missed out on all the fun that everyone else had, and you missed seeing people, you just stayed home alone, you didn't have that positive experience, you feel worse. You feel even worse and maybe a bit more hopeless and ineffectual, like I can't get anything done, what's wrong with me? And when you feel a bit worse, then this will increase the depression symptoms a bit more. And so the cycle is, the depression causes you to be tired. Because you're tired, you don't do anything. Because you don't do anything, you feel worse. And because you feel worse, you get more depressed. And so the work of curing depression is to reverse the cycle of depression. And that's often done by, like, working with a support person or a therapist or psychologist or someone to slowly do more and more activities, even if they don't feel good because you're depressed and you don't have a sense of pleasure. You still do more and more activities, and eventually you start to reverse the cycle of depression.
That's good to know. And how do you not fall into depression? You basically force yourself even though you're tired, or should you take a
mental health day?
Or so
I think how to avoid falling into depression would be, if you have been really overactive or doing a lot of things and you feel tired, give yourself some time to rest, but don't let that drag on, and make sure that even if you are resting, you still do one thing per day that you need to do. You still see friends, you still do pleasurable activities. If you start to feel like you have so much stress that you're falling into depression, talk to friends, arrange something really enjoyable, maybe go to an amusement park like Linnanmäki or something like they have here in Helsinki, and try and have fun and laugh and try and stop the cycle from happening.
Okay, thank you. Is it only medical professional who can identify if someone is depressed and needs help, or if no, how can anyone learn to identify that state?
It's a good question. I think that actually there are many questionnaires on the internet where you can identify for yourself or for your friend if you have depression. So you can look up these questionnaires. Some of them, for example, one is called the BDI, one is called the DASS21, one is called K10. So you can also just look up general depression questionnaires, and they will probably ask questions relating to those symptoms that I mentioned. So they might ask, are you feeling fatigued? Are you feeling sad? Are you feeling depressed? Are you having suicidal thoughts? Are you having a loss of interest in activities and feelings of worthlessness? Those kinds of questions. So if people tend to check those kinds of boxes, then they'll know that they're depressed.
Okay. What are the red flags of suicidal possibility?
Right. So, what is a red flag for if somebody might actually commit suicide? I think there's a few. The most common one is that they have tried before, they have maybe attempted to commit suicide before. Another flag is, do they have a clear plan? Do they have intent? So that would be, I have a plan to overdose on this type of medication that I have in my house and I'm going to do it tonight. For example, that would be a red flag, that there's a plan and an intent. And in that case, you should definitely take action. Another red flag would be that they might be very, very depressed and suicidal, and then suddenly they seem very calm and like everything's okay. This can sometimes be that they feel like the solution is that they will commit suicide and they've found their solution to their problem, and they might start to tidy up their affairs, plan to die, and so they might, tidy their house or give objects away to friends or say goodbye to them, things like that. That would be a really big red flag. Also, if they just simply tell you the plan and they are really serious about it, that's obviously a red flag as well.
Last question is, why would a person tell that they want to die? Do they usually want to be helped?
I would say yes.
Yeah.
Yes, I think when somebody says that they have suicidal thoughts and they want to die, I think that in telling another person they want to be helped. They want the other person to do something. Yeah, absolutely.
So that's the reason usually they tell that to another person.
Yeah, exactly. And the other reason is that when you're in that state of severe depression, severe enough that you have suicidal thoughts, you're not functioning very well. It can feel like you're living in a fog. You know, you might move slowly, you see things in black and white, like you're hardly coping in some ways. So they might not have the resources to book the appointment to the doctor themselves, or make a phone call themselves, or figure out how to fix depression. Maybe they've never had a mental health problem before in their whole life, or they don't know anyone else who has, and so they want the other person to help them when they're in the middle of the depression.
Thank you so much for answering these questions. And
you're welcome, Anastasia. Pleasure to be here.
Yeah. And would you like to tell a little bit about yourself, or?
Yeah, sure. My name's Annabel Battersby, and I'm a clinical psychologist at Campus Psychology in Helsinki in Finland. And I'm also a member of a group called Psychological Practitioners Finland, and we have a website. It's called mentalhealth.fi, and on that website you can get information in English on how to get free mental health help in Finland, you know, in different circumstances, if you want to just talk to somebody, or if you want to learn more about how to go to the public system and get free mental health help. And we also will have a list there of different practitioners, like counselors and psychologists, who work in lots of different languages. So you can find someone there who might be suitable to treat you.
Thank you.
Yeah.
And thank you everyone for watching. And if you made it this far,
subscribe.
Bye.
Bye-bye.